You're testifying on Capitol Hill today before the House Small Business Committee about the impacts of hospital and large practice integration on small and solo medical practices. Over the last year, as many as 70% of ACC physician members have integrated with hospitals, including yourself. In your mind, what are the key drivers of this trend?
Well, there are several of them. Uncertainty is one of the major issues about what the future holds, but reduced Medicare physician reimbursement is one of the big things. The 2010 Medicare rule that reduced the reimbursement to the cardiology practices as much as 35% made it essentially impossible for some of those practices to stay independent, and so the only choice was to integrate with the hospital.
Aside from physicians integrating into hospital settings, what are some other unintended consequences of the failed sustainable growth rate and uncertainty within the Medicare physician reimbursement? And how does this affect patients?
Well, it affects patients a lot because, one, it may make it more difficult to them to get access. So where they could easily get to a physician's office, that may change significantly. But a big thing, actually, is that services that were provided by cardiology practices, they may not be able to do anymore. An example would be a Coumadin clinic, where the cardiologists are following the pro times of patients that are on blood thinners. Well, they may not be able to afford to keep those services going.
Which regulatory or administrative burdens do you think is the biggest threat to cardiologists?
There are so many of these burdens, it's hard to pick out just one. But there are so many things coming down the road, like ICD-10, all the audits, the recovery audit contractors. Right now, a cardiologist might be subjected to having all of their reimbursement taken back by a recovery audit contractor just because Medicare decided this was an outpatient versus inpatient procedure.
What steps can Congress take in the near term to achieve payment stability and increase sustainability among small and solo practice physicians?
The first and most important is to get rid of the sustainable growth rate problem. And so we need to have stability in the payment going forward, and Congress needs to make sure that physicians are reimbursed appropriately for the services they're performing.
So this is the second time in 2 weeks that ACC has testified before the Congressional Committee. What makes ACC stand out among other specialty organizations?
The ACC has been a leader in so many areas related to quality, particularly. All our registries, appropriate use criteria, and other measures that we've worked on for years are actually in the forefront in medicine among the whole field of medicine. And so we feel that we're really out in front, and I think that's the reason we're asked to participate in these hearings.
So what is one key message that you hope members of Congress take away from your testimony?
Stability and certainty for the future of medicine is what's important. Get rid of the SGR and find a stable Medicare payment system.